medicine and oops, okay. Let me just get rid of that. Just to tell you a little bit about her, she was born and raised in Beijing, China, and came here when she was 20 to go to college. She went to Wellesley, subsequently received her MD from Johns Hopkins, and subsequently did a residency at Johns Hopkins Bayview Medical Center. She subsequently did a fellowship at the Kimmel Comprehensive Cancer Center, also at Hopkins. She also did a Master's of Science in Clinical Research, which is from the University of Maryland. Ting is the immediate past president for the Society of Integrative Oncology, and she is a joint faculty member at the MSK Integrative Medicine and Breast Medicine Services. She is board certified breast medical oncologist and medical acupuncturist and an integrative medicine physician. She has conducted many innovative clinical trials that examine safety, effectiveness, and underlying mechanisms of acupuncture to improve cancer patients' quality of life and to address treatment and disease-related symptoms. And all I can say is really her work has been invaluable to the care of our patients. Because of all of her clinical and her research expertise, she is well known on a national and international level. She is a member of the NCI Physician Data Query Complementary and Alternative Medicine Editorial Board, which is a big thing. She's also a member of the Alliance for Clinical Trials and Oncology Symptom Intervention Committee, and she's a speaker and panelist for many NCI conducted workshops on oncology acupuncture and cancer complementary and alternative medicine. So I really just want to extend a warm welcome to Ting for taking time out of her busy schedule to share her expertise with all of us. Ting?
Thank you so much. Zarak, do you have any housekeeping issue? If not,
Oh, right, I forgot the housekeeping. Yes.
As you all have realized, we are recording this session. If you'd like access to it, please contact me directly. I have changed everyone's name to guest. We are going to start shortly. I am already looking at the presentation in guest mode and do not see Dr. Vadat or Dr. Bao's image. So I am concerned that we are already having a little bit of a glitch, but not to worry. If you just bear with me 1 second, I will try to figure this out. Thank you.
So maybe if we share the slides, we'll see if people
Yes,
can.
please start sharing your slides, see if that will.
I'm sharing slides. Can you guys see it?
No. So
I can see it.
yes, then that is the same problem we had in a previous session. I figured out a workaround. All attendees, please know I will be making you co-host so you can actually view that. That is where the glitch is coming. So we've come up with a workaround. So just bear with me while I do that to everyone.
Zarek, I can see it.
You're seeing it now? Thank you.
It's always something.
I can see it.
There we go. Everyone should be able to view now. If you have any other concerns, please message me privately. Dr. Bao, please continue. Thank you, everyone.
Great. Thank you very much. So it's really my pleasure to be here and talk about integrative medicine for breast cancer patients. Thank you, Linda, for such a wonderful introduction. And so my background, so I'm a board certified breast medical oncologist, and I'm actually also a medical acupuncturist and integrative medicine physician. And I conduct research on integrative oncology. And so far I finished 6 pilot studies, and right now I have 2 ongoing large randomized controlled trial. Hopefully their practice changing. And my long-term career goal is really to integrate complementary medicine into oncology practice to improve each patient's quality of life and overall survival. So this is going to be a sort of a pretty broad introduction of integrative medicine. So I'm going to start defining and distinguish the difference between integrative medicine and alternative medicine. Then we will talk about different kind of integrative medicine therapy approaches that may be helpful for breast cancer patients. And then summary, and then open up for Q&A, question and answer. So first and foremost, it took us many, many years to really kind of separate this two. So integrative versus alternative. So that's why if you look around, every time we introduce ourselves, it's always integrative rather than alternative medicine. Mainly because alternative primarily suggests that the usage of integrative medicine instead of complementary medicine, instead of conventional treatment. And then usually is kind of doesn't really have too much scientific basis. So we're trying to say we're not doing alternative medicine. Rather, we do integrative medicine, which is more like evidence-based and used alongside conventional treatment and primarily focus on side effects and pain management. So there are different types of integrative therapies that include mind-body therapy, massage therapy, music therapy, acupuncture, diet, nutrition, supplement, exercise, and fitness. We'll touch upon them. So usually when we talk about complementary integrative medicine therapies, we usually kind of divide them into 4 categories. And the number one is those that is safe and helpful, and also safe and not quite sure if it's helpful. And there's others are useful, but with risk. And then there's definitely some with is harmful and no benefit that we should probably avoid. I would say one example is something like lots of people want to use is the vitamin B17. So it's has cyanide poisoning and doesn't really treat cancer. So it's definitely harmful and no benefit. So I strongly recommend people not to use it. And then in terms of the safe and helpful one, one example is actually mind-body medicine therapy, such as meditation, hypnosis, guided imagery, this list. So as you can see, none of them really have like remarkable, any significant side effects, and more so, more and more research showing they have significant benefit. And especially, I would say, point out this mindful-based stress reduction. It basically sort of a program combine meditation, yoga, and really it's like 8 weekly session, and you go to a special course, and then once you finish that, you come out, really can manage your stress much better. And all the literature suggests it's really helpful with no side effects. So these are the approach we usually recommend to patients. And then in terms of massage therapy, we know it's safe. And in terms of whether it's helpful, whether it's efficacious, it needs more study to be done. And there are different kinds of massage, as you can see. And I mean, most people really like massage. It helps relax them. And overall, at this point, most data basically suggests it's like has transient but welcome and important benefit, such as reduce chemo-induced nausea, vomiting, reduce pain, inflammation, improve circulation, improve mood, and also just feel very comfortable. So that's something we usually recommend to patients. Specifically for breast cancer patients, our massage therapists said they have great success with those different symptoms, syndrome, like Asbury-Webb's syndrome, sort of those cording, and then lymphedema, and also post-mastectomy pain syndrome. We are conducting a phase 3 randomized control trial in metastatic cancer patients, and basically randomized patients half to acupuncture, the other half to massage. And both groups actually seems to show significant improvement in pain reduction. So how about acupuncture? So that's actually dear to my heart, mainly because I'm also board certified acupuncturist and I have my acupuncture clinic. So it has been shown it's generally pretty safe in terms of helpful or not. More and more data are coming out. So for those of you who haven't done acupuncture, it involves Harrison needle put in specific point in the body. We usually use a guiding tube, and then this is a needle, and then we tap the needle and then remove the tube and then manipulate the needle to the point you have this 得气 sensation, meaning gaining energy. So that's like a sensation of feeling soreness, achiness, that we actually think we're hitting the A delta nerve and then cause the nerve stimulation and reach therapeutic effect. So that's, and it started in China, as you can see, and the needles are placed along the 14 major meridians, also called the energy channel. And yeah, so that's, in terms of the mechanism, I kind of alluded to that already, just meeting people. And then, so study definitely shows that acupuncture seems to work through modulating the nervous system. So the idea is when you insert the needle and stimulate the A delta nerve, that sends signal to the brain, and then that can stimulate certain neurohormone secretions, such as, for example, beta endorphin. So some people during or after acupuncture feel like they're very happy in cloud nine. Not everyone, but some people. Yeah, so like neurohormonal pathway. And then other studies suggest it's decreased inflammation, etc. So there's definitely some solid mechanism behind it. In terms of, you know, which condition it really helps, we know we actually have pretty strong evidence showing that acupuncture helps reduce pain and also help reduce chemotherapy-induced nausea, vomiting. Those has pretty solid evidence. And then there's some evidence suggesting it helps with hot flashes. It's a little, the reason why we put it in the middle is because sometimes if you compare like different type of acupuncture, it's not like one type may not be better than the other, but when you compare it with usual care, it's definitely better. And then dry mouth and GI immobility or insomnia helps. So our center recently completed a sort of phase 3 randomized control trial for people with insomnia. We randomized them into cognitive behavior therapy versus acupuncture. And both groups basically showed significant reduction in insomnia score. And then there's some modest evidence on acupuncture reduce anxiety, fatigue, and depression, and minimum side effects. So definitely worth trying. Specifically for breast cancer patients, this aromatase inhibitor-induced joint muscle pain is definitely one of the side effects lots of people experience. And we do have a large randomized control trial showing efficacy. And also my research is actually on acupuncture to reduce chemotherapy-induced peripheral neuropathy symptoms. So we have an ongoing 250 patients randomized control trial to really see if that helps. And then nausea, fatigue, hot flashes. And the reason why I graded the lymphedema is because we, even though I want to say acupuncture help with everything, but unfortunately we conducted a randomized control trial on acupuncture and lymphedema. It's actually not better than usual care. So at this point, we kind of say we're not certain. It may work for some people, but not necessarily in our trial, not necessarily based on our protocol. So this is the trial I was referring to. So this was published in JAMA, which is like a really big high impact journal. And this was done at the SWOG, South American Oncology Working Group. So 220 some patients randomized into 3 arms, real acupuncture versus sham acupuncture versus no acupuncture. And then, as you can see, the real acupuncture reached like 58% reached greater or equal to 2-point pain reduction when compared to sham versus usual care. So, and then when you look at their pain reduction, average pain reduction scale, so the real acupuncture reduced pain more, like 1 point more compared to sham versus usual care. And minimum side effects, the most common one is bruising, which go away. So that's why we usually recommend acupuncture for aromatase inhibitor-induced joint muscle pain. And then as some people have needle phobia, so acupressure comes in handy. It's sort of the self-care thing. You can learn to do it at home or have your family member do it on you. So there's a few points that we usually recommend. One is like this intang point in the middle between the eyebrow. And then that helps reduce anxiety. And then this point at your wrist can potentially help with insomnia and depression. So yeah, so it's not, you don't have to get needles. So sometimes you can do pressure. And then, so moving on, so let's talk about the nutrition, diet and nutrition. So basically, I'm also an integrative medicine physician. Often when patient come to our clinic, the first question they ask is, doctor, what should we eat? I think many years ago, people would just say, eat anything you want. But I feel like now with more and more data, observational data, even randomized control trial, that's not necessarily the right answer anymore. And more like major organizations are recommending activity and healthy diet to cancer survivors. So basically this is, I think it's World Cancer Research Foundation, American Institute of Cancer Research Foundation. So together, they come up with this guideline, basically introducing diet linked to increased risk of cancer, which is red meat. So that's significantly increased risk of colorectal cancer, and processed meat because of this preservatives, and then alcohol drinks, more relevant to breast cancer patients. There's observational study basically saying the more alcohol intake patient have, the higher risk of breast cancer they have. And then foods containing sugar. So there has been more and more data on that. I would say there's, I think it was 4 years ago, MD Anderson published some animal data and basically showing food, they give animal higher and higher dose of sugar, and the tumor spread much faster. So those are animal data primarily. But regardless, honestly, I think nowadays, I would say 100 years ago, people don't put sugar in everything. But now you turn around, look at the label, they almost put sugar in everything. I used to really like this naked juice. And then once I turn around and look at the label, they had like 53 grams of sugar in one little bottle. So that really made me pause and think about, all this unknowingly how much sugar I'm taking in. So regardless, I think cut down sugar is helpful for many reasons, not just cancer, also diabetes, etc. So, and then there's diet linked to decreased risk of cancer. Those are like vegetables, fruit, and food containing dietary fibers, vitamin D. So those cruciferous vegetables we usually recommend: broccoli, Brussels sprout, cauliflower, kale, etc. And then, so this is kind of the recommended diet: diverse, balanced, and plant-based, and 3 to 5 serving. Each serving is fist size. Vegetables, and 2 to 4 servings non-sweet fruit. So those are usually the berries, are non-sweet fruit. And plant-based proteins. I don't necessarily recommend everyone to become vegan or vegetarian. I do think there's some merit in some animal proteins. Use your judgment. And then if for pure vegan, we usually check their vitamin B12 level, because that's the vitamin we usually get from animal protein. And then we do recommend to limit like red meat, and limit alcohol intake, limit processed meat, and then limit sugar and all this sweet stuff. So, and kind of related is obesity. So we know that obesity is a very important cancer risk factors, and obesity is linked to postmenopausal women like breast cancer, and also linked to all these other cancers. And as you can see, this is what's happening. So our country, like the adult are getting more and more obese for many reasons. And then the health consequence of obesity is significant. Heart disease, diabetes, cancer, hypertension, hyperlipidemia, stroke, liver, gallbladder disease, sleep problem, and joint problem, and GYN problem. So all this problem. So that's why the physical activity is really important in addition to diet. So as you can see, study shows 25% of cancer cases are related to sedentary lifestyle and obesity. So exercise is really important, and all exercise are important, are good. So yeah. And usually for me, I would just tell my patient at least walk for half an hour per day, preferably 5,000 steps or more per day. And that's moderate exercise already. So it's not that hard. And then to choose physical activity over sitting. So basically, someone was saying sitting is a new smoking. So get up and walk around every hour. So our, like I mentioned, ultimate fitness goal is like 30 minutes of sustained moderate intensity exercise, greater or equal to 6 days per week. And then exercise is amazing. So basically all these trials shows exercise wins, and it's better than not exercising, just because all this benefit and yeah, on the body. So strongly recommend exercise, just keep moving. And then specifically the mechanism, especially related to breast cancer. So more exercise can actually decrease estrogen level, can really help as well, and decrease inflammation. So there are clinical trials about this. So nurse health study, basically, they're observing patients, with following the nurses, and among them, almost 3,000 nurses had breast cancer. And then they found out like the increased survivorship are really correlated with regular fitness, physical fitness, exercise. The more, the better. And also decrease risk of dying. So I always tell my patients, exercise, because it helps you live better and longer. And then this is the dietary supplements. That's actually the second to diet. That's another important question our patients ask us in clinic. And so I would say the short answer is we really try now to use the dietary supplements or these bottles, pills, to kind of replace the diet. That's first. And then second, many dietary supplements are really not recommended for cancer prevention. And I'll explain why. So there has been studies that lots of cancer survivors are already using different kind of dietary supplements. And then the problem is, in terms of preventing cancer, the benefits are not clear and there's conflicting data, and we really need to be cautious. So for example, the vitamin E and cancer prevention. So we know that some pilot study shows vitamin E can reduce risk of liver cancer. That's why NIH spent millions of dollars to conduct this select trial in prostate cancer population. Basically randomize patients in 2x2 table to selenium plus vitamin E, or selenium only, or vitamin E only versus none. And then at 5 years follow-up, there's no difference. At 7 years follow-up, there's significant increase in prostate cancer risk in patients taking vitamin E and selenium. So it's completely different from the hypothesis. They have to really stop the trial. So yeah, so be careful. The more may not be better. And then in terms of vitamin D, so it also depends on cancer type. Study basically suggests like vitamin D help decrease the risk of breast cancer. But then for prostate cancer, it's a U curve. So too low or too high is not good. The middle is better. Usually that's like 20 to 40. And then colorectal cancer is like the higher the better. So it's varies. So we probably need to really look at individual case and then decide whether you should take it or not. It also depends on the level. I mean, I don't necessarily think the higher the level, the better. I have patients on like really high dose vitamin D, came back, the level is like 150, and that's almost dangerous. And calcium is high, and some other patients were having palpitation. So yeah, probably need to just watch closely and check level periodically. So our About Herbs website basically has 280 plus monographs on different kind of herbs supplements and talk about all these things. And that's a great resource to go to. And another thing to kind of caution is basically, just some are, lots of them, I mean, we have patients, I definitely have seen patients coming in with like 20 different supplements. And then some of them are not really necessarily safe, and potentially others can potentially interact with medication. So just be mindful about certain supplements containing high levels of phytoestrogen, such as alfalfa, like chasteberry, dangui, which is a Chinese herbs, lots of Chinese medicine has, grapeseed and kudzu, and licorice root. That's good for GI symptoms, but then can potentially contain lots of phytoestrogen and all this like red clover. But with that being said, there's certain form like have a little bit, so you don't have to be like totally just be sort of paranoid about things with a little soy product. And lots of time they don't have too much, too high a dose to cause any significant clinical consequence. And then in addition, just be mindful that if you're taking dietary supplements, some of them can interact with the anti-cancer treatment. So for example, like some antioxidant can interfere with radiation therapy. Some can increase the risk of bleeding, and then some has phytoestrogen, which I just mentioned, and then some can change the metabolism of your medication, such as tamoxifen, and then lead to either too high or too low blood level, and that's not good either. And lastly is like dosage does matter. So, I mean, this altogether, all these 20 different kind of supplements has like 20 milligrams. So the chance of them causing any problem is low because dosage is low. So in summary, basically leading cancer center are really starting to integrate integrated medicine into cancer care delivery, and clinicians should be aware. And a number of integrated medicine therapies can help cancer patients and should probably be recommended to them. And more studies are needed. So this is where we're based at, although we're moving in 1 month. So this is right now is at 74th Street and First Avenue, and we provide mind-body therapies, exercise, fitness, nutritional consult, acupuncture, massage, and physician consultations actually in another building. But this is where we are. And those are the sort of resources, and that's where I got those information from. And then I'm happy to answer any questions. This is sort of a broad overview, and the rest is all for like question and answers and discussion.
Thank you, Dr. Bao. I have some questions coming in. One is to ask you about whey protein powder in healthy smoothies or powder drinks.
I think those are fine. Yeah, so I do have patients asking about those, and usually they're okay, but I do want to like just make sure, learn how to read the label. But yeah, in general, some protein powder, if you're not taking enough protein, that's fine. Yeah.
Thank you.
Sure.
The next question is, how much sugar is too much sugar? And with the second is, how much alcohol is too much alcohol?
So in general, the guideline is no more than 50 sugar in total. So, and then usually, you know, in food and stuff, other things, usually you automatically get 25 grams of sugar already. So in terms of additional sugar, usually try not to do more than 25 grams of sugar. I'll give you an example. One apple has 19 grams of sugar already. One banana has 11 grams of sugar. So maybe half apple, half banana. And so be mindful. Yeah. And then in terms of alcohol, I would say we usually recommend no more than 2 drinks per week. That's moderation. That's okay. Yeah. Should I look at the chat?
Right.
Yeah.
I'll read them out to you. Is aloe vera meat healthy in smoothies?
I think it's fine. Yeah, you can add aloe vera there. That's fine. Yeah.
And I have a question. So
Sure.
what is an optimal vitamin D level? You said not too high, not too low. Where do you sort of feel is the sweet spot?
Right. So our center basically said 30 to 100, I think nanogram per ng/dl. But I think 100 is a little high. I'm actually fine with, I think anything around like between 30 to 70, I think is reasonable. Yeah, if it's around 50, it's like perfect. Yeah.
Okay,
So
just,
ahead.
sorry, Dr. Mathat, thank you. Can you please review any information on acupuncture for neuropathy?
Yes. Yeah, I'm actually preparing a talk, but yeah, so acupuncture for neuropathy. So basically our team has conducted 3 pilot studies. The first one is introducing acupuncture in patients, breast cancer patients undergoing weekly paclitaxel and developed grade 2 neuropathy, meaning it started affecting their function. Then we introduced weekly acupuncture until they finish the 12 weeks acupuncture, 12 weeks taxol, the end of chemo. And then basically that shows with acupuncture, it seems to, although we don't have a control arm, that's why we need to do a follow-up study. It seems to prevent the worsening of neuropathy symptoms. So basically neuropathy symptoms was getting worse and worse with weekly chemo. And then once we introduced acupuncture, it plateaued. So yeah, and then that we're hoping to do a follow-up study and with the control arms if it helps. And then another pilot study we did was in patients who already finished chemo at least 3 months ago and still have significant CIP and chemo-induced peripheral neuropathy symptoms. Then we randomize them into 3 arms: real acupuncture, sham acupuncture, and no acupuncture. Basically, and give them 10 treatment in 8 weeks. And what that shows is by the end of starting in 4 weeks, you already can see the 3 lines are separating. But then at week 8, real acupuncture has about 1.7 pain point reduction compared to like 1 in sham acupuncture compared to no change in usual care. And then importantly at week 12, when you stop all the acupuncture follow-up for 4 weeks, and then the real acupuncture's pain reduction persisted, whereas the sham acupuncture pain reduction like just resolved, went back to no difference compared to baseline, and the usual care didn't change much. So because of that, we got a huge grant. So we're running randomized control trial, 250 patients, randomized to real versus sham acupuncture in the same population. We also are trying to figure out if we can find some kind of predictive marker to predict who will respond to real acupuncture. Yeah, so we're doing a different kind of like quantitative sensory testing to find out which one can predict. So that's that. So it's still ongoing. And then I think for patients with neuropathy, ideally, if you can join a trial, that'd be great. But if you're not, it's if your symptom is really bad, it makes sense to give it a try. Yeah, the acupuncture. Yeah.
Can you see the questions in the chat, Ting?
Oh, now I can see it. Yeah.
You can, yeah.
Yeah, so it's 125 microgram per serving. So that's equivalent to 5,000 international units. I don't think it's that too high. Depends on your level. So I would say if your level is totally normal, like between, I would say, 50 to 70, then 2,000 international units, which means 50 microgram is fine. But then if your level is really low, like 20, even like low normal 30, then this one, 125 microgram, which means 5,000 international units, is fine. It's not too much. I would recommend maybe just check the level like every 6 months. And so that if you're taking this, just make sure you're not overshooting it. Yeah, sure.
Another question that's come in is there a standard regimen of integrative medicine that helps, or is it based on the individual treatment or symptom?
That's a great question. I would say there's certain approach would help everyone. Like the meditation, I actually think is like standard approach. Whenever a patient come to my clinic, integrated medicine clinic, I always recommend meditation. In fact, another thing I recommend is journaling. I just think for some reason, lots of breast cancer patients are very anxious and worry a lot. So journaling has been shown to be very effective yeah, really prevent sort of PTSD, all this. So, and it's no side effects. So I usually I ask everyone to journal and then to clear their mind, then meditate to calm their mind. Then if they're religious, to pray to elevate their mind before they go to bed. And that usually helps them with sleep and many things. So that's kind of standard approach. And I don't necessarily recommend acupuncture for everyone. I think that's the individual approach. Depends on the symptom. If they have lots of pain, sure, try acupuncture. But not everyone. I mean, some people have needle phobia, and maybe it's not the right thing to do. So those, yeah, depends on the symptoms, and those are kind of more individualized than we can talk about it. Yeah. So, but yeah, I think everyone should do meditation and journaling. Yeah.
The next question is, what is Reiki?
Reiki, I think it's is it Japanese or some kind of energy medicine? So it's kind of it's almost like intention, like yeah, sometimes without like touching the people, and then you face them and kind of give them like healing energy, and that some people are very like responsive to that, but it doesn't necessarily work for everyone. There has been some study in Reiki to treat different kind of symptoms. So, and I don't think there's any side effects like toxicity associated with it. So I think it's worthwhile to try if you're interested. And I think it's easier to get trained to do Reiki as well. So yeah, I'm supportive if people are interested in doing it because minimum toxicity, yeah, and potential benefit.
Thank you. The next question is, how do you get patients? Referral? Could you tell us a little bit about the cost?
How do I get to patients? Referral, yeah. So they usually, if they're MSK patients, they basically, I think their provider putting an order and refer to integrated medicine physician. And then if they're not MSK patient, then usually sometimes they can just call my office. It's like 646-888-0865. And just call, my assistant will just take down patient's name and generate a sort of a patient ID, medical record number, and then set up for a new visit. But for the patient who is not an MSK patient, we usually require them to fax us the medical record, or at least bring it to the first visit. Yeah.
So we've sent a lot of patients to Ting and her office, and they've been very helpful, and they've made it really easy for us to send our patients there. So it's, you know, if it's something that you're interested in, you should do. Don't be put off by the fact that there might be a few steps involved, because it really was very smooth sailing.
Thanks.
That's all the questions I have from the panel. Dr. Vedat?
All my questions were answered, especially surrounding the alcohol and the vitamin D issues. One thing that I saw that you mentioned was about soy, because there's been a lot of discussion about soy, and there were some randomized trials that were done from the Mayo Clinic group, which suggested that soy was okay. But I see on your list some soy, all soy is not created equal. So
yeah, I think at this point I agree. I think it's important to distinguish soy as a whole food rather than the protein powder extracted from like mainly soy. I think the soy as whole food, I think there's enough data suggest even just one serving per day is safe and is fine. But then those like protein powder or some powder only extracted from soy product, that can be a problem, like 8 grams. Jackie Bromberg actually did a study, it's a window of opportunity study a few years ago. So she basically, one patient had a biopsy diagnosed, and then they gave them the protein powder, 8 grams of protein powder from the soy product. And then and then look at this, and then after a few weeks, the patient underwent surgery, then look at the surgical specimen, then they compare all this gene expression. And that one actually, the soy protein powder enhanced some of the sort of the proliferatory gene, bad genes expression. So that's, yeah, so as a result, I think, soy as whole food, like tofu and stuff should probably be okay. I wouldn't go more than 1 serving per day. But then those like protein powder exclusively extracted from soy product, I may just stay away, or even just take it and not 8 grams. That seems quite high. Yeah.
So I think sort of like with everything, moderation is okay, and any extreme is probably not.
Exactly.
Yeah.
Exactly. I think so. Yeah. Is there a charge for the cancer patients for this service? Oh yeah, that's a question I didn't answer. I think for the MSK patients, physician consultation is free. So it's under the umbrella. It's maybe not free, but anyway, it's kind of just covered by the insurance. And in terms of acupuncture, it's half-half. Some insurance cover, some don't. And then in terms of massage, it's not free. I think it's because of the lack of solid evidence for long-term benefit. So insurance wouldn't cover it. So that's, you have to pay out of pocket. In terms of music therapy, it's primarily inpatient, so that's all free. By the way, I didn't mention that, but music therapy has been shown to decrease anxiety. There are 2 forms of music therapy. One is sort of passive, and another is sort of meaning you just listen to music. Another is interactive. You work with music therapists, make music, and both actually help. It seems to show decreased anxiety, decreased depression. So it's pretty good. If we are patients at the Whittingham Cancer Center in Norwalk, are we considered part of MSK? Linda, you may know that.
Okay, I had to unmute myself. So no, patients who are at Whittingham Cancer Center are not considered MSK patients. I mean, they're not in the MSK system. We use a different electronic medical record. So it's a different system. There's strong collaboration, but it's a different system.
I've received 2 questions.
Sure.
One is, do you recommend any certain type of meditation?
I'm not an expert on meditation, so I think any type is good. So yeah, I personally just do my own meditation. It's very simple. I started doing when I was little. So I basically, I journal, and then I clear my mind. Then I just sit in the half lotus position on my bed before I go to bed, and then half close my eyes, and then just take deep breaths, and then I hold my hands this way, and then I play with the energy between my hands, and then I count up to my age, but recently I have to stop because I'm getting older. It's too long. So, so at least 20 times, and then try to clear my mind completely. So that's kind of meditation I do, and I found it helpful. But then everyone is different. I think it may be better to, if you're interested, we do have meditation expert in our center, and you're welcome to either like set up an individual session with her or join our integrated medicine at home program. It's called I Am at Home. So basically patients pay $25 per month. Then they have free access to 17 classes per week. They're all half-hour Zoom class, and that includes meditation, yoga, exercise to strengthening the bone, and music therapy, etc. I'm just going to type the phone number here so that, you know, if you're interested, you can try it out. And then you get to meet our meditation expert, and then potentially can like set up an individual session. Yeah.
Wonderful. For those interested as well, we have a meditation, deep breathing online program here at Nuvance. And I'll put our information, our phone number down. The last question I received is, does journaling, music therapy, pet therapy fall under integrative medicine or complementary medicine? And what is the difference?
That's a good question. I think I think it's integrated medicine. So the major difference is evidence-based. So complementary is sort of, you know, using alongside with the standard treatment and all this sort of non-pharmacologic approach. But integrative medicine just basically suggests it's evidence-based. There's trials behind it. I think journaling, there's definitely clinical trials behind it. Music therapy, definitely trials behind it. PAT, I'm not really sure about clinical trial. So, but regardless, I think, yeah, if they have clinical trial to back them up, since we're trying to practice evidence-based medicine, we call this sort of integrative medicine. Yeah. Oh, by the way, I just want to add, the reason why we're trying so hard to kind of distinguish, step away from alternative medicine is because there has been more and more like trials basically suggesting patients, especially breast cancer patients who ended up doing alternative medicine instead of integrative medicine, their risk of dying is like 2.5 times higher. So that's why we're trying to say we definitely don't recommend alternative medicine at this point, especially for breast cancer patients.
So I think, do we have any other questions, Sarah?
No, we don't. Those are all.
Yeah, there's some questions here in the chat. What is phone number of Norwalk Medication Center? Medication Center? Or
It's integrative medicine. Phone number is 852-852-CALM, C-A-L, which is LM, sorry, 203-852-2256.
Great.
And I guess there's a question regarding what is the optimal surveillance for vitamin D levels? I mean, once a year, twice a year.
I usually do it twice a year, but I think once I did too often, the insurance company were upset. So I think twice a year is relatively safe. Yeah.
Okay. Okay, so if we don't have any more questions, Ting, I want to thank you for such a wonderful, comprehensive overview of, you know, complementary medicine. I feel like we're all smarter after having listened to you. And I hope that people will, you know, really utilize all of the services either at Nuvance or at MSK in order to really help them feel better. And, you know, first step is finding out about them. So thank you so much.
Oh, sure. Thank you so much for inviting me. It's been wonderful. Thank you.
Thank you, everyone. Have a good night.
Good night.